So Steve, let's just dive into kind of mechanisms of disease pathogenesis of HS. It's super complicated, right?
So complicated. We're right now collaborating with our friends down the street at Henry Ford and doing a genome-wide association study where you just kind of draw a bunch of blood samples from people, look at their DNA and see where there tends to be little differences, because it's not one of those easy genetic diseases of, autosomal dominant, autosomal recessive like blue eyes are. It's more complicated, but we're seeing mutations in the hair follicle genes, which makes sense to us because we know the hair follicles are involved, the immune system and the way it reacts to things, and then some of the healing genes too, which may be why these don't really heal the right way. We think it all kind of starts at the hair follicle. The hair follicle gets blocked up. That causes the oil to build up. The bacteria are already in there, kind of normal bacteria, but once they're trapped and they start really growing, the hair follicle ruptures. That triggers a lot of inflammation. And then is when we get that abnormal healing process where instead of just kind of draining and healing, it starts to form these under the skin tunnels. And it's strange. And this is one of the big challenges in HS is the pathophysiology kind of changes. So in the early stages, really centered on the hair follicle. And that's why something like laser hair removal can be really effective. But once you get the tunnels, they get these tertiary lymphoid structures, we call them, all around it, where it's so packed full of inflammation and T cells and B cells, it looks like a lymph node. So then those are just sort of this nidus of ongoing inflammation. And that's why a lot of times we'll see patients where medical therapy gets them so far, but then they need some surgery for the tunnels. And once you take the tunnels out, then everything is really calm because you've gotten rid of that source of inflammation in addition to sort of treating the underlying inflammation and preventing new spots from popping up. But yeah, we're constantly learning more. And every time I hear the people who are doing awesome research in HS pathophysiology, each time I hear a talk, I go, oh, you figured it out. And then the next talk comes up and I go, oh, you figured it out. Oh, yeah. And then I'm like, how do I put this all together? There's neutrophils involved and macrophages and T cells, and regulatory T cells are super low in HS, which maybe is why the inflammation is so out of control. But it's a hard one in clinic too, because patients go, okay, why did I get this? And it's complicated. It has to do with your genetics, maybe the microbiome that lives on your skin, your hair follicles. But the big thing I always emphasize to patients is it's nothing you did. It's not your fault. It's not because you smoke. It's not because you're overweight or obese. It's not because something you ate or your hygiene. It's nothing that you did. HS is not your fault, which is a good message for the patients, because sometimes in their journey, they don't get that message. They do get a little bit more shame and blame from providers who sort of misunderstand some of those comorbidities and think that that's the cause of HS is obesity or smoking versus just it's a comorbidity.
I call it a kitchen sink diagnosis because we throw all these different treatments at it. Just trying to help these patients. We deal with the hormones, right? We spironolactone, for example, birth control in females as well. We deal with the microbiome. It might be a topical antibiotic, or we talk about nutrition. We talk about bathing. The inflammatory component, certainly that's huge, as we know. It's just so difficult to treat these patients. And I feel for young dermatologists just coming out of residency or trying to figure their way out, and they get these HS patients and they may not have very much experience, but it's truly one where you need multifactorial treatment in order to really alleviate the symptoms for these patients.